Before the project started in Campsie View, my mum would be constantly having urine infections. She was always being tested for UTIs, and she would be on antibiotics frequently. I would come in and she would be uncomfortable. She'd have to be going to the toilet all the time. She was anxious about being near the toilet, always saying wherever we went, if I took her out somewhere, I need to go to the toilet. And she would be anxious because she was rushing to go to the toilet as well. She felt that it was imminent and she really needed to go. So that was upsetting for her. She would also, when she had a UTI, I would know as soon as I came in, just by the expression on her face, the way she was behaving. She would be unsettled, she would be agitated, she could be a wee bit more intolerant and angry with people. She was unhappy as well. She was unhappy, and that's a big thing for me, because with my mum's condition, there's so many things that I can't do. I can't make her better, but what I feel, if she's happy and she's content, then I'm happy and content, because that makes me feel better to know that she's okay, that she's the best that she can be as such. And so when this was going on as well, because of the amount of antibiotics she was having to get, I was concerned that there would come a point where she was no longer, they would no longer work for her, where she would become resistant, they would become ineffective, and then what would happen to her? What were the consequences of that? How was that going to affect her health? If there was nothing we could do to make her feel better, to get rid of these infections. The benefits to my mum of being part of this project have been that she has been much more content. She has been much more settled. She doesn't rush to the toilet anymore. She doesn't have to take the antibiotics, so she's not on antibiotics. She's not getting UTIs. She's actually not getting the infections in the first place. So the preventative measures that have been taken as part of this project have actually stopped it even getting to that stage. So I'm not concerned anymore about the level of antibiotics that she's on. I'm not coming in and seeing her agitated to the same extent. And in fact, not at all. She's very content. She's very happy. And for me, I actually noticed a difference within a few weeks. It didn't even take months for me to notice the difference in my mum. I noticed the difference within weeks, and I commented to the staff as well about this, because I felt this is great, her being part of this. This is improving her well-being. It's improving her life. And that was one of the things that I thought was important to do with this as well, because anything like this is not just helping my mum, it's helping other people. And if there's ways where just taking it a wee bit more notice of what's happening, or a wee bit more, I'm not saying that people weren't taking care, but actually having procedures in place and processes in place that have been proved to be effective in preventing these UTIs, it means that it helps the residents, it helps the staff as well. And there's a dignity thing there as well. Although she's old and although she has dementia, she still knows that she's having to wear pads and they're uncomfortable, and she would get distressed if she had an accident and things like that. So that's not happening anymore. So that's actually improving her life, and it's, I just think it's a great thing. I think the sort of changes that in the way that the staff were dealing with my mum, there were things like they were taking her to the toilet on a regular basis. So they were monitoring that as opposed to waiting until, so it was more of a proactive approach than a reactive approach. And things like making sure she's got plenty of fluids, and just keeping a wee eye on all these things that are important for my mum to make sure that she's comfortable with going to the toilet, with whatever she needs to do. So it was more like she was being kind of led, in, as opposed to my mum coming and saying to them, I need to go, I urgently need to go. I think the staff are much more aware of what helps in these situations. I think that this project is probably giving them more information, like you say about the double voiding. I'd forgotten about that. Yeah. So just by doing these additional wee practices, because they've learned what they are, I feel that they are probably more focused on it now, because it's a project and because it's something you have to think about, other than just things being done on a day-to-day basis as they always were. There's now a focus on something different, to try something new, to learn new techniques, and to see how these techniques are effective or not effective. And I think that the techniques they've learned have been effective, certainly for my mum. My advice to anybody whose parents or relatives, loved ones are experiencing similar things to my mum experienced, is to ask the staff questions, to ask if, is there any way we can look at preventing this? What are preventative measures for these circumstances, rather than just we'll go to antibiotics again or we'll use pads? Could there be other techniques there? Could we be looking at a fluid chart? Could we be looking at taking them to the toilet in a more proactive way? Could we be looking at preventing this? And I think rather than always kind of taking a reactive measure to things, always trying to look at we should be looking at the cause and seeing if we can prevent, because it's so much better for the person concerned, because they don't get into that position in the first place. I think that I would always think that involving the NHS, and if they have the expertise, I think that we should always look to find as much information about anything in life that we possibly can. And I think that the care staff could, if they can get assistance and expertise from the NHS, then I think that's a great idea, and they should, seek as much information as possible. I don't think it should just be accepted as a part of ageing that you're going to have incontinence problems. It shouldn't just be, well, that's just how it is, because it doesn't have to be just how it is. That it's been shown with what's happened with my mum here. It didn't have to be just how it was with my mum, because this has changed her life, and that well, it's actually quite a big way. I was going to say in a small way, but it's not. It's actually quite a big way, because it's improved her day-to-day living, and it doesn't matter if she's old. It's still important that we try and find the best ways to deal with things, and we shouldn't just accept that that's going to happen, because it doesn't have to happen. This has proved that it doesn't have to happen. In my opinion, that's what it's done. And if there's expertise out there, then we should always look to look at that and to explore it and see how we can, because this is going to become a much, much bigger problem. With an ageing population, we're hearing about that all the time. I see it all the time because I'm here, and everybody knows people who've got people that they care about and they love, who are getting older, and it shouldn't just be accepted. If there is a way of dealing with it, then we should be dealing with it. Yeah.